Hello everyone, Sam here from Mind Body Medical. So today is episode 1 of Empowered Self-Care, and today looking at osteoarthritis, looking at how we can use evidence-based research, natural approaches, natural medicines to manage the symptoms of osteoarthritis and trying to arrest and ideally reverse the actual progression of the condition. The whole aim of these episodes, the whole aim of the Empowered Self-Care series is to really help people. If you know anyone, friends, family, colleagues, etc., who are suffering osteoarthritis, if you could send them the link, give them the information they need to help manage their condition using these evidence-based approaches. Help spread the word. If you could like this video, if you could subscribe to the YouTube channel, try and really help us spread the word. So, osteoarthritis. The UK, the public health data from the UK suggests that over 9 million adults in the UK are living with osteoarthritis. That's an incredible number of people. It equates to around 14%, slightly over 14% of the UK population living with a progressive, often debilitating pain condition that's going to be having symptoms that will be affecting their quality of life and their functional capacity. So this isn't a small problem. It's not an insignificant condition. It's having big ramifications for millions and millions of people. The data suggests it's one of the most prevalent causes of disability in the UK and in most Western countries. The research from the States, from America, North America, is very, very depressing, I suppose. There, the issues around osteoarthritis, the prevalence rates, and the disability caused by osteoarthritis in North America is very, very bad. And it's something that's only going to get worse with an aging population. More and more people are going to be living with this condition as we're getting older and we're living for longer. It's something that it's become a bigger problem, a more prevalent problem, and something that's only going to get worse. And that reiterates exactly the need for self-care. It absolutely is one of the conditions that absolutely reinforces the need for evidence-based self-care. Giving people the tools, the knowledge, the science, the evidence that they need to go away and proactively take control of this condition, this problem, so that they can improve their quality of life. So, what is osteoarthritis? So, osteoarthritis, sometimes called degenerative arthritis, is a broad heading for generalized degeneration of the joint. And most of the symptoms are caused when the cartilage within the joint wears down, so that you get rubbing, you get friction, you get contact between the bones within the joint capsule, and they rub together. And there's lots and lots of symptoms, lots and lots of subtle and gross symptoms that are consistent with osteoarthritis. But these are some of the main ones. So the obvious ones are pain. Discomfort in the joints are affected, pain, swelling, soreness, loss of mobility, loss of flexibility. So a lot of people, particularly if they're getting into their 60s, 70s plus, will find things like getting in and out of the bath, in and out of the car, bending over to tie shoelaces up. These kinds of things are increasingly impaired by the progressive symptoms of osteoarthritis. So a loss of mobility, tenderness, deformity, joint deformity. You see it very often in the hands, seeing the knuckles and the fingers quite badly deformed. Swelling, the sensation of grating bones. Sometimes if you extend the joint, you can hear the grating within the joint capsule. And all that impacts upon an inability to perform, like I said, basic daily tasks the way we want. If we want to have a bath, but we can't because we can't get out because of osteoarthritis, that then becomes a big problem, because it stops us doing the things that we want to do. If we can't go sailing, or we can't play golf, or we can't walk the dog because of these problems and these symptoms, then it needs to be managed. So that creates a slight problem, in as much as there are quite significant shortfalls around the conventional management of osteoarthritis and osteoarthritic symptoms, because the approaches that are used to manage symptoms. They're not aiming to get to the root cause. They're not aiming to actually regress the problem so that the symptoms become less burdensome, because you're actually aiming to regenerate and re-nourish the joint itself. And also the conventional treatments for osteoarthritis come with quite a broad range of severe and less severe risk factors and side effects. So the less severe things like heartburn, reflux, stomach ulcers, inflammatory stomach conditions are quite common. And then at the extreme end, there's evidence showing how the conventional treatments of osteoarthritis carry the risk of blood clots, heart attacks, and even strokes in extreme cases. So these aren't small things. So there are very obvious shortfalls within the conventional management. That's not to say that the conventional management doesn't have a role to play. It has a fundamental role to play, particularly in allowing people to do more by taking away the symptoms. And all this is about trying to dovetail the two, taking the very best that conventional medicine has to offer, but supporting that and enhancing it with natural evidence-based medicine. So there's never been a time, there's very, very robust data now, there's very, very clear evidence to show that there's a wide variety of approaches, natural medicines that can be used to impact upon the symptoms and progression of osteoarthritis. And it's that I'd like to talk about today. So there's lots of things. This is by no means exhaustive. There's lots of other herbs and supplements and minerals and foods that we can call upon to manage osteoarthritis. But these are our top 5. These are the 5 approaches that we routinely turn to in our clinic whenever we're managing osteoarthritis, degenerative joint conditions. These are the 5 approaches that we turn to as the vanguard, as the frontline treatments for osteoarthritis. So boswellia, Indian frankincense, turmeric, Maharanan oil, MSM, and omega-3 fish oils. So we're going to go through those, look at what they do, and then look at some of the dosing and go through them individually. So boswellia. So boswellia is it's Indian frankincense. Frankincense is its other name, boswellia. Within the Ayurvedic framework, it's one of the most called upon, one of the most revered and utilized herbs there is. And it's the primary anti-arthritic medicine within the Ayurvedic framework alongside turmeric. And it's interesting because there's now very, very clear Western evidence to validate that Ayurvedic view. In Ayurveda, if you have arthritis, boswellia is the herb you'll turn to. Very, very clear, rigorous Western research showing that that's an absolutely valid approach. So one of the reasons for that is boswellia has been clinically proven in a replicable manner to block this 5-lipose oxygenase, which is an enzyme that provides, it's the foundational mechanism that creates joint and arthritic pain. If we can block that enzyme from working, we inhibit the pain and the inflammation that is experienced during osteoarthritis and degenerative joint conditions. So it severs that enzyme. So it has a profound effect upon managing the pain associated with osteoarthritis. And it's so effective in that role that there's been studies looking at the effects of boswellia in comparison to NSAIDs, so non-steroidal anti-inflammatories. And they're on a par. If you compare the pain relief from boswellia compared to NSAIDs, they're roughly on a par. So it has a profound biochemical effect upon managing the symptoms of osteoarthritis. Furthermore, it's not just about blocking the mechanism of pain. That's what the conventional approaches do. The natural approach is aiming to do more than that. It's aiming to actually regenerate the joint so that the symptoms become less severe over time. And that's what boswellia does. It's been shown to inhibit the breakdown of joint tissue. It's been shown to actually slow down how quickly joint tissue degenerates. So by default, it slows down the progression of arthritis in the first instance. Crucially, it's been shown to increase blood supply to the joints. and increase the elasticity of the joint and the joint tissues, which means we can move more freely. It increases functional capacity. So looking at things like getting in and out of the bath, in and out of the car, walking the dog, etc., that increase in blood supply, the increase in elasticity and the movement range is a very, very important benefit of Boswellia. In terms of a dose, there's a little bit of uncertainty around what is an optimal dose for Boswellia. Generally speaking, 270 milligrams of Boswellia, but the crucial thing here is that within that dose there's at least 65% isolated boswellic acid, which is the compound that is responsible for these broad benefits. So most good brands, good producers of Boswellia will have that as standardized. So it's each capsule 270 milligrams with an isolated 65% boswellic acid, and having 1 to 2 capsules per day is a fantastic dose for managing and inducing these benefits. So that's Boswellia, absolute, almost mandatory herb and a mandatory approach for managing osteoarthritis. The second herb is turmeric, and that is typically used, alongside Boswellia. If you think of Boswellia, you'll use turmeric as well. If you think of turmeric, you'll use Boswellia. The two exist so harmoniously, it's madness to not combine them. So turmeric, I think, is one of the most well-known medicinal herbs in existence. Most people are aware of how profoundly therapeutic it is in terms of its anti-inflammatory benefits. Western science has shown there's over 100 active chemical components within turmeric that give it the therapeutic effects that it affords. The most well-known one is curcumin. It's one of the most powerful anti-inflammatories in existence. It's been trialed clinically, and the effects, the research is absolutely robust about the responses that it induces in inflammatory conditions, particularly joint-based inflammatory conditions, and particularly osteoarthritis. So it's a mandatory component of a natural treatment plan for osteoarthritis. So that the anti-arthritic effects of turmeric are multifactorial. It's not just taking the anti-inflammatory response. We know it does that. We know it reduces inflammation in the joints. It reduces swelling in the joints, which is a big problem in osteoarthritis. The swelling that you get increases stiffness and pain. So it reduces the swelling. It slows down how quickly the joint degenerates. So it's, again, like Boswellia, it's not just reducing the symptoms, it's not just reducing the inflammation, it's not just increasing functional capacity, it's actually slowing down the destruction of the joint tissue. So it's slowing down the progression of the disease in the first place. So if you've got turmeric and you're using it alongside Boswellia, you're putting in two evidence-based, profoundly effective herbs that are treating the symptoms and are slowing down the progression of the arthritis as well. So that's the most we can hope for. That's a fantastic approach. So it's a fundamental component of an osteoarthritic treatment plan. Generally speaking, we're looking at taking somewhere between 1,000 ish milligrams of organic turmeric a day. Some people will go higher, some people will go 1,500, 2,000 milligrams. It depends upon how bad the problem is and how long it's been there, but it's a good starting dose to test response. 1,000 milligrams of turmeric, so most capsules will come in 500 milligrams, so one capsule twice a day. Just making sure though that you're buying the supplier that you're using, making sure that it's really good quality turmeric, organic if possible, and making sure that there's pepperine included within the formula, within the capsule, because we know that when pepperine, black pepper, long pepper, doesn't really matter, is included, the uptake of the chemical constituents of turmeric can be up to 1,000% more effective. So it's madness to not mobilize that mechanism. So making sure you're getting turmeric with pepperine included in it. So that's turmeric, powerful herb for managing osteoarthritis. So we covered Boswellia, we covered turmeric. Number 3, Maharanan oil. Maharanan oil is alongside Boswellia the go-to turn to Ayurvedic intervention for osteoarthritis And actually any pain condition, whether it's muscular pain, skeletal pain, joint pain, it's nerve pain. So it's a medicated oil. So within the Ayurvedic framework, there are hundreds of medicated oils. So medicated oils are usually in a base of sesame oil, and then you put, there's 7, 8, 9 plus 10 herbs infused into that oil. So the sesame oil is used as a carrier to carry the herbal compounds into the body, and Maharanam oil is profoundly effective within the osteoarthritic framework. It's a potent anti-inflammatory, and it's a potent analgesic, and it's also a potent joint regenerator. So it's ticking all 3 boxes. It's reducing inflammation, it's reducing pain, and it's restoring the structure of the joint. We know that it increases flexibility, it increases functional capacity, it increases elasticity in the joint, it reduces swelling in the joints. In our clinic, it's often the approach, the long-term approach, that induces significant long-term benefits. So people being able to get up and down the stairs more effectively, in and out of the bath more effectively. It never fails to astonish me how profound the changes are in quite a short period of time when you add Maharanam oil into an arthritis treatment plan. There's over, in the Ayurvedic framework, there's over 3,000 years of time-tested use around the benefits of Maharanam oil in this context. So to not make use of this is madness. It's super easy to use as well. That's the beauty of this. It's not difficult. So once you get the oil, it's a case of warming it up. The absorption through the skin is a lot quicker when it's warm. So warming it up and just liberally applying it to the joint in question 1 or 2 times a day. So if you've got osteoarthritis here in your elbow, ideally in the morning and ideally right before bed in the evening, just warming some oil up and just really, really working it into the joint. The benefit of doing it at night time is that it's going to work on the joint all the way through the night when you're not moving as much and you're not sweating, so you're not pushing the oil back out. So apply it liberally 1 or 2 times a day. If you're only going to do it once a day, do it in the evening before bed. It's pretty easy to source Maharanam oil. It's not something that you'll find in most health food shops because it's quite niche. But if you go online, you'll find good suppliers. We stock top quality, authentic Maharanam oil on our website. So I think it's an approach that we can use that's not in taking something. It's not a pill or a capsule. It's a topical application, which is what we want. We don't want one trick pony. We want a broad spectrum approach, and this being a topical application, it ticks that box. So for us, it's a vital, key component of an osteoarthritis treatment plan. The fourth approach, MSM. It's a big mouthful to pronounce the full name, but it's the evidence has been shown to induce almost miracle-esque responses in arthritic symptoms. I mean, some of the research around MSM consumption in clinical trials when used to manage osteoarthritis have been nothing short of astonishing. It's one of the supplements that's kind of jumped into the Western framework very, very heavily because of the research. So it's a naturally occurring sulfur. So it occurs in our bodies, so plants, animals, humans. It's a naturally occurring compound within any organic being. But it has such multifactorial benefits. It reduces inflammation, it improves flexibility. But the big benefit of MSM over the other approaches is we know it powerfully restores collagen production. And that is essential, it's fundamental in managing osteoarthritis because it restores the actual structure of the joint. It's regenerating, it's rebuilding the joint. So not only are we treating the symptoms, we're regenerating the joints. It's the same as everything else, the boswellia, the turmeric, the Maharanam oil. You're putting things in that are taking away the symptoms and regenerating the joint. So there's there's lots of trials done around MSM. There's a great trial looking at the effects of MSM supplementation on osteoarthritic pain in 118 patients, and they compared it to a placebo and looked at the effect. And after 12 weeks, after a 12-week period, there was clinically significant improvements in pain, swelling and joint mobility in the group taking the MSM compared to the placebo. And clinically significant, some of the gains weren't close to significance, they were profoundly significant. They were very, very big improvements, particularly in the pain and the mobility. People were seeing big reductions in pain, big improvements in their ability to perform tasks. So MSM dosage, you're looking at taking 500 milligrams 3 times a day to give you 1500 milligrams a day, which is a great therapeutic dose of MSM. And lastly, omega-3 oils, the fifth component of the 5-step plan, omega-3 oils. Probably, along with turmeric, one of the oldest approaches for managing osteoarthritis. It has historical data going back decades now about the effects of omega-3 supplementation on arthritis. There's many reasons for that. The two, it contains very high doses of EPA and DHA, which are 2 essential oils that are very, very prevalent in omega-3, which has been clinically proven to decrease inflammation within the joint capsule. A very, very well conducted, rigorously trialed study in the journal, Global Journal of Health Science. It looked at swelling and pain in patients with osteoarthritis. It looked focused in on 2 specific symptoms, swelling and the tenderness and pain within joints. These patients were given a daily supplementation of omega-3, organic omega-3, after 3 months, which is not a long period of time, that's pretty quick. 77% of the patients saw a 70% improvement in their condition, to such an extent that most of them were able to completely come off their conventional painkillers. That is a massive finding. So 77% saw a 70% improvement. That's a lot of people noticing a significant improvement in symptoms over a very short period of time. So that's profound evidence. And the beauty of studies like that is that's in isolation. It's just looking at one approach, just omega-3. If we then add in the other 4, if we add in the boswellia, the turmeric, the maharanan oil and the MSM alongside the omega-3, the gains we're able to induce will probably be a lot more significant than that. So in my mind, to try and manage osteoarthritis, to slow down progression, to manage the symptoms, to not utilize a good quality omega-3 fish oil is absolute madness. The evidence is robust. So generally speaking, if you're looking to use omega-3s to intervene for osteoarthritis, the general recommendation is around 2,500 milligrams of omega-3 fish oils a day to get the compounds, the EPA and the DHA, the level of these in the body to a point where we're going to be looking to induce these benefits. And most of the studies most of the clinical trials which have assessed omega-3 in that context have used somewhere between 2,000 and 3,000 milligrams. So 2,500 is a nice middle ground. So in conclusion, we know that those suffering with osteoarthritis, the number of people suffering with it is increasing. We know that it's progressive, it's going to get worse. We need to empower people with tools that they can call upon to manage it themselves. And there's never been a better time to do that because of the explosion in research showing how natural medicines can have a clinically significant impact upon the progression of the disease, how quickly it progresses, if at all, and how significant the symptoms are, trying to regress the symptom load, get people off long-term pain-killing medication, increasing functional capacity, helping people to move more freely, live more freely, continue to pursue hobbies and interests that they couldn't do because they can't move as well. So for us here at Mind Body Medical, those 5 approaches form a mandatory structured approach to managing osteoarthritis. I can't recommend them enough. They're simple approaches. They're supplements and herbs that you can get routinely from most health food shops. They're safe, they're evidence-based. So Try them out. If you're experiencing osteoarthritis, if a friend, a family, a colleague is, send them this link, send them this information so that they can benefit from it, so they can start experimenting, so that they can be empowered to look after themselves rather than relying on someone else to do it for them. There is a caveat, which applies to all supplementations, herbs, etc., is that if you're under medical supervision, if you're pregnant, if you're breastfeeding, if you're taking conventional prescriptions, if you've got liver or kidney disease, make sure you get these supplements checked out with your healthcare provider before starting supplementation to make sure there's no negative or adverse interaction. But other than that, do your own research, get going with this, and try and reap the benefits of these amazing evidence-based natural medicines.